to ride Pegasus, Chapter 1. The slick pavement, oily with rain and motor lubricants that had dripped from the hundreds of ill-repaired vehicles utilizing the major north-south artery into Jerhatin, caused the accident. Henry Darrow had not been exceeding the speed limit when he passed the old two-seater, but he had a date with destiny, and kept it on time. Had there been no rain that day, or had the lane been closed as scheduled for resurfacing, or had the old two-seater maintained the minimum speed in the left-hand lane, Henry Darrow would not have been exasperated enough to pass, would not have skidded on the slick paving, would not have crashed into the guardrail, would not have fractured his skull so that a bone fragment pressed against the brain pan. Had the accident occurred even half a mile further up the arterial road, Henry Darrow would not have been sent to the one hospital in the area equipped with a special electroencephalograph. As things came to pass, this was how his accident was to occur. Exactly how. In fact, he had jotted down the exact time in his astral notebook, 10 hours, 2 minutes, 50 seconds post-meridian. He had also reminded himself that day not to take the arterial route back into Jerhatin, but he had not foreseen one slight delay at the gasoline station which had caused him to change his mind and take the fateful route, forgetful of his own prognostication. Of course, since it was a major turning for him as well as millions of other people, he could never have avoided the accident, which is why his subconscious, or so it is maintained, prevented him from remembering his forecast at the critical moment. Henry Darrow was therefore injured seriously, with minor fractures in the left lane, as well as the depressed fragment of skull bone. Had Henry been fully conscious during surgery, he would have assured the surgeons that, despite the severity of the wound, he would live. They would have been dubious. Henry Darrow knew when he was going to die, from myocardial infarction, some 15 years, 4 months, and 9 days in the future. He couldn't tell them since the cranial pressure affected his speech center, and he was mercifully unaware of his surroundings. Brain surgery can be a harrowing experience. The operation was technically successful, and Henry was assigned a bed in the intensive care ward, cardiac and encephalographic monitors keeping close track of his vital systems. The Southside General Hospital boasted the very latest technology, including one of the ultra-sensitive electroencephalographs, familiarly known as goose eggs. The goose egg equipment was developed during the Apollo flights in the 70s to monitor the effects of the mysterious lights which periodically afflicted the astronauts and to record any suspected damage by cosmic radiation to the brain tissue. The ultrasensitive equipment was primarily used now in hospitals to detect brain damage to newborn infants suffering oxygen starvation during birth, or, as in Henry Darrow's case, brain injuries where similar oxygen deprivation, bleeding, and pressure must be ascertained. The intensive care nurse on duty when Darrow regained his sense after surgery was, as destiny preordained, Molly Mahoney, a rather plain girl who good-naturedly bore a lot of teasing from her colleagues for her avowed dedication to nursing. She was invariably assigned the critical cases because she had a knack of pulling them through the crises. "Dr. Sherman, would you look at the printout on Mr. Darrow's EEG?" she said when the resident checked in at her station. "The alphas are unusually strong for a man as critically injured as he, aren't they?" Sherman looked obediently at the graphs, nodded sagely, and then gave her a wink. "He been conscious at all? Giving you a line?" Molly shook her head, very serious, though she knew he was teasing her. Sherman always did. "He's not regained consciousness, Dr. Sherman. I'm to notify Dr. Wallman when he does. But should I give him a ring about these readings?" Don't bother, Molly. That one's lucky he can print anything out on the goose egg. You'd have thought he'd have known better." "Better? About what? He was an accident casualty, wasn't he?" "Better about going out at all. He's Henry Darrow, the astrologer. Christ, it costs a fortune to consult him about your future," Sherman snorted. "And he couldn't cast his own properly." Sherman left after a cursory glance at the other IC patients. Molly Mahoney looked with renewed interest at the brain injury. She knew of Henry Darrow, though she wouldn't have admitted it to many. No more than she would have admitted to anyone that she felt she had the gift of healing. Unlike her grandmother, who had no medical background and ran into problems with her healing hands, Molly had professional cachet and knew best how and when to apply her whammy. Having a unique talent, Molly was keenly interested in all the paranormal manifestations. In her lexicon, the astrologist merely used the signs of the zodiac to focus a precognitive gift. One fortunately more scientifically based than tea leaf reading or card telling, just as the nursing profession allowed her to focus her healing talent on a scientific basis. So she knew of Henry Darrow and now tiptoed, like an odd sycophant, to the bedside and stared down at a face she hadn't noticed before. His face had character even in lax-jawed abnormal coma. The eye sockets were black and blue pits, and here and there a trace of blood had escaped the emergency cleanup. It was unfair of her to look at him in such a condition. She laid the back of her hand gently against his cheek, not liking the color of his skin. She flicked back the sheet, took a fold of the pectoral skin, and gave it a brutal twist. Well, at least he had reactions. She patted the sheet into place and stroked his cheek again. The cardiograph pulsed slow but regular, though there were traces in the reading that